I now have the honor of introducing the Secretary of Health and Human Services, Kathleen Sebelius. Before joining the Obama cabinet, Secretary Sebelius was governor of Kansas and was named one of America's top 5 governors by Time magazine. Then in April 2009, she became the 21st HHS secretary and made it her focus to improve the delivery of health services to the most vulnerable populations, including young children and the elderly. With this goal in mind, one of the Secretary's most important priorities is to implement the provisions of the Affordable Care Act, thereby helping 34 million uninsured Americans get health coverage. Thus, her remarks tonight couldn't be more important for the summit or more timely for those of us on the front lines in fighting the twin epidemics of viral hepatitis and HIV/AIDS. Already, the HIV and viral hepatitis community can celebrate the meaningful changes taking place under the ACA to expand preventive care, including expanded access to free HIV screenings for every American between the ages of 15 and 65. In looking ahead to 2014, we anticipate a significant expansion of the number of Americans with viral hepatitis and HIV who are able to enroll in the various federal programs. When this occurs, people who are currently falling through the cracks of the healthcare system will have access to the package of essential health benefits that all state health exchanges must offer, including disease management, lab services, and prescription drug coverage. At the same time, the ACA will make critical investments to improve public health, surveillance, community-based programs, and outreach efforts, all of which will address the economic, social, and institutional barriers that are behind the HIV and viral hepatitis epidemics. With so much at stake, all of us here tonight are anxious to hear how this is proceeding with the implementation of the ACA, and especially how the ACA will improve the standards of care for Americans with viral hepatitis and HIV/AIDS. So please welcome Secretary Sebelius, who will focus on the prospects for the ACA to be a true game changer that dramatically reduces infection and increases support for those living with viral hepatitis and HIV. Welcome, Secretary Sebelius.
Thank you very much. Well, I first want to apologize to Sarah. I didn't realize I was entering in the front of the room, so I didn't mean to make that such an awkward entrance, but thank you for your work. Thank you, Dr. Miller, for that kind introduction, but more importantly, for your leadership and hard work. And I also want to thank John Bartlett and Kenneth Mayer for working with a terrific staff and making this important summit possible. I'm really pleased to have a chance to join you on the opening day of the summit and really look forward to your information and input as we work to develop policies. You know, Sarah gave you a presentation, but she's been a great leader as the Chief Public Health Officer for HRSA for a number of years and does a terrific job. So again, I apologize for the little bit of a interruption. I do want to take a minute before I make some general comments to recognize someone who's been a driving force in the fight against HIV/AIDS, Kevin Kevin Fenton. I'm thinking of the Kevins at CDC, and that's another Kevin. But Dr. Kevin Fenton has brought incredible compassion and vision to our work to reduce the impact of HIV/AIDS and other infectious diseases. He's played a critical role, particularly over the last 4 years. First, helping to shape the national historic HIV/AIDS strategy from its earliest drafts to the powerful roadmap that we have today. Kevin, as you all know, recently announced that he's returning to England to take on an exciting new opportunity, working to improve health and to address health disparities. Now, we're all incredibly sad to see him go, but I have a commitment for you, Kevin, that we're going to continue building on the legacy you've left behind for years to come. So could you join me in thanking Dr. Kevin Fenton? So we're gathered here tonight, as Veronica's already said, at a moment of great progress. What we know is that in the United States, infections among injecting drug users have dropped more than 80%. Pediatric cases of HIV are down more than 90%. And today, when someone is diagnosed with HIV and treated before the disease is far advanced, they will have a nearly normal life expectancy. Now, that would have been unheard of to even say out loud a number of years ago. Those gains on the clinical side have been accompanied by major breakthroughs in science, including the recent finding that treatment itself is one of the best forms of prevention. And as you know, on Saturday, December 1st, we will once again commemorate World AIDS Days. And I encourage all of you to visit AIDS.gov to learn how you can personally participate in this year's worldwide commemoration. The last few years have also brought long overdue attention to the epidemic of viral hepatitis. FDA has recently approved a new rapid test for hepatitis C. New treatments are now available to cure up to 75% of hepatitis C infections. And even more promising treatments are in the pipeline. The addition of hepatitis C to this summit is in itself a testament to the growing awareness of the disease. But we also know we have a long way to go. Right here, where you're gathered in Washington, D.C., 1 out of every 16 black men is HIV positive. Nationally, HIV infections have stopped falling and are actually rising among young gay and bisexual men. And death rates related to hepatitis C have risen dramatically. And that's why President Obama has made our battle against HIV and viral hepatitis a top priority for this administration. In the past, when we've supported other countries' efforts to fight HIV and AIDS, the first thing we ask them to do is establish a comprehensive national strategy in order to draw down American funds. But until President Obama came into office, we had never taken that basic step here at home. And now we have. Working with experts, including many of you, across the country, we developed an historic national HIV/AIDS strategy that is guided by the latest science and focuses our resources where they can make the biggest difference. Last year, we brought the same approach to viral hepatitis when the department created its first ever action plan for the prevention, care, and treatment of viral hepatitis. For way too long, viral hepatitis had been virtually unknown to the general public and to policymakers. Even many healthcare providers didn't have a full understanding of the infection. And consequently, there was really never any comprehensive effort to address the full impact, even as it claimed the lives of as many as 15,000 Americans every year. So the new action plan is designed to change all of that. To develop a plan, we brought together everyone who had a part in fighting viral hep at the federal level, from the CDC to the FDA to HRSA, the Bureau of Prisons, the Veterans Administration. And those experts began to chart a course, a path forward that begins by raising awareness and focuses on high-risk population like the large number of baby boomers who are living with hepatitis C. These plans have given us some very strategic roadmaps to reduce the impact of both these diseases. And I'm proud to say that both the plans are turning into action. Now, I see it every day at the federal government where our efforts have kicked into far higher gear. But what's even more heartening to see is what a lot of you are doing. what's happening in states, communities, and organizations around the country that are embracing strategies to deal with HIV and viral hepatitis. We're also trying to support your efforts with additional funding. For roughly a decade before this president came into office, domestic HIV prevention funding had been flat. Since President Obama has been in office, resources have increased every year. And that's good news. Long overdue, good news. But part of the effort is not only to just increase the resources, but really target those investments so they make the biggest impact. Already we've made some key changes in how we distribute funds to health departments for prevention, moving to a new formula that reflects the needs of today and not a look back at yesterday. We're also supporting the interventions that we know have proven effect to have high payoffs, like prevention with positives and condom distribution. And of course, we'll continue to focus our efforts on HIV testing. Most recently recommended in the draft guidelines for public comments from the U.S. Preventive Services Task Force for all Americans age 15 to 65. Now, we know it's not enough to make testing and treatment available and just tell people, go get it. If it were, we wouldn't have the kind of fall off we see today. We wouldn't have 200,000 people with HIV who don't know their status, and then another 200,000 who, on top of that, haven't been linked to care, and 250,000 who haven't been retained in care. So out of the 1.1 million Americans living with HIV/AIDS, that's a big portion of folks who still are falling through the cracks, or if they're found at one point, do not retain that treatment. And we know that's an area we can do better and we must do better. So we're beginning to support programs that build strong linkages at every step, from testing to care to continued treatment. This summer, I visited an organization, again, right here in DC, called the Community Education Group, and they are getting incredibly impressive results with a new approach to HIV testing and treatment. So first of all, they go out and find people in the neighborhoods in key areas where they feel testing is needed. And instead of just handing people a referral slip once they get tested, and this could be in a mobile van or at the clinic, they immediately schedule the first doctor's appointment, sometime that day or the next day. And then they provide transportation, not just for that first visit, but for the first 5 visits. And if the individual stops going to the provider, they go and find them once again. Now, there are tracking incredibly important and positive results. Nationally, our linkage to care is just at 66%. This DC organization is closer to 90%. So we need to take those kinds of proven practices, the techniques that we know will work, and scale them up and close that gap between testing and treatment. Now, that's also true for viral hepatitis, where as many as 3 out of 4 people living with hepatitis B and C may not even know they have the disease. So we're working to apply the lessons we've learned from the fight against HIV and AIDS. This year, for the first time, the CDC awarded $6.5 million from the Affordable Care Act to help communities implement hepatitis testing programs, with a special focus on linking patients to counseling, treatment, and care. So this focus on prevention and care coordination runs a common thread through so much of the Affordable Care Act. And it's a big part of what makes the law one of the most important pieces of legislation in the history of our fight against HIV, AIDS, and viral hepatitis. And again, I'm happy to speak to you at a time where we now have crossed the hurdle of the Supreme Court decision. So the Affordable Care Act was found to be in large part constitutional, and of the election. so that now we have a president committed to fully implementing the Affordable Care Act. That's a big new day in this fight. I'm still kind of getting through that thought process. It's hard to believe. But in addition to supporting the work so many of you do at the community level, the law also has dramatically expanded access to coverage for people with HIV, AIDS, and viral hepatitis. As you know, for years we've had a health insurance market where insurers made profits by trying to avoid sick people. It's great for insurance companies, and it is a pretty good profit strategy. But it's terrible for people who have the highest health needs, including those with HIV, AIDS, and viral hepatitis. In effect, people who needed the health insurance market the most were the ones often shut out, dumped out, locked out, or priced out of the market. Now, that wasn't right, and we just put out rules last week to end that discrimination. So starting in 2014, the law will ban insurance companies from turning anyone away because of their health status. And that, again, is a huge step forward. The law, as it's being implemented, already provides some protections from some of the worst insurance companies' abuses. For instance, an insurance company can't any longer put a lifetime cap on insurance benefits or cut off coverage because someone made an error on a form. We also look forward to Medicaid expansion so that Medicaid will be available to many more Americans with HIV and AIDS and viral hepatitis, including single adults without children. And finally, yes, and that is a big step also, the law also invests huge resources in the expansion of community health centers, increasing access to testing, treatment, and care, especially in underserved areas. In fact, between the investments in the Recovery Act and the investments made in the Affordable Care Act, the number of patients able to be served by community health centers will double in the last 5 years. We'll go from 20 million patients to 40 million patients, and that's a huge step forward in building that public health infrastructure. We need to continue to discuss both the ADAP program and the Ryan White program as they will exist in the future. Clearly, there will still be gaps in the new health insurance system, so those conversations are underway right now about the reauthorization. As that system changes, we need to have your input about what services and gaps you are anticipating and how we can make sure that people don't fall through the cracks. We want your perspective from the front lines to make sure that these programs remain strong. The worst of all worlds would be that the expansion of health insurance and that the expansion of Medicaid, in fact, would decrease service availability to many of the patients we're seeing. So when this summit convened for the first time 6 years ago, our nation's fight against HIV and AIDS had nearly stalled. The number of new infections had plateaued, and the general public's concern about the disease was clearly continuing to fade. And meanwhile, viral hepatitis remained a silent epidemic, even as nearly 100,000 people were newly infected every year. But here we are today because we refuse to accept those trends. We look closely at how and where we could use our resources. And together, we made a commitment to help make sure that the best approaches reach those most in need. Out of that collaboration came our two powerful national plans. And today, we have a very clear strategic roadmap for the months and years ahead. But in order to fulfill that promise, we must continue executing those plans. And that's why I'm so glad to see so many of you leaders here today, because we can't possibly do that work without your leadership. So I'm here to ask a very specific question. I want you to keep your foot on the accelerator. Now isn't the time to ease up or shift a focus. If we're going to reach our ultimate goal, which is on the horizon, of an AIDS-free generation, if we're going to eliminate the silent epidemic of viral hepatitis, we must all challenge ourselves to do more. We need your expertise. We need to know about your best practices and your model programs so we can make the most out of the opportunities we've had, make the most out of the Affordable Care Act, and make the most out of improving people's lives at every point along the treatment cascade. The federal government stands ready to be a full partner in this fight. Together we can raise awareness to new heights and make our programs even more effective. We can push the boundaries of science even further. We can help more people get the support, treatment, and care they need to live healthy and productive lives. And that's why we're all here working together. So thank you for being here, and I look forward to hearing your great ideas. Thank you very much.